What is COVID-19? CO stands for corona, VI stands for virus, D stands for disease, and 19 stands for 2019, which is the year it originated in. Coronaviruses are a large family of viruses that cause respiratory problems that can range from mild to life-threatening. What are the signs and symptoms of COVID-19? Fever, cough, and shortness of breath. How is COVID-19 transmitted? Well, according to the CDC, based on current knowledge of coronaviruses, COVID-19 is thought to be spread via person to person through respiratory droplets among close contact. Infectious secretions include sputum, serum, blood, and respiratory droplets. What are the steps to take to protect yourself from COVID-19? Assess and triage patients with respiratory symptoms and risk factors to minimize the chance of exposure. Have the patient who is of suspicion wear a mask and ensure they are in a room alone with the door closed or that they are isolated from others. Use standard transmission-based precautions. Use hand hygiene before and after contact with contaminated surfaces and patients. This includes the use of alcohol hand rubs and washing your hands washing your hands for 20 seconds with warm soap and water. This also includes practicing correctly donning and doffing your PPE, using routine cleaning and disinfection procedures. These procedures can be the ones that were previously used with SARS, and those are acceptable. When caring for patients, try to stay 6 feet away when possible. PPE you should use include an N95 face mask or respirator when they're available. Try to use these when you're performing aerosolizing generating procedures. Glasses do not count for a face shield, so you'll need a face shield, gloves, and gowns. Use these when they're available. What should you do if you've had an exposure to COVID-19? Well, if there's been an unprotected exposure to a confirmed or possible patient, you should contact your supervisor immediately. If you develop the symptoms of COVID-19, fever, cough, or shortness of breath, do not go to work. Please stay home and don't contaminate others. Instead, contact your supervisor immediately for further instructions. Movement and monitoring of these patients should be made with consult of public health authorities.